You can
Okay,
zoom it
madam.
out. All right. So without
Right.
wasting a minute, we'll quickly begin. Good evening, everyone. A very warm welcome to all our participants joining us from across the country and beyond. I'm Dr. Noori Ali, Senior Homeopathy Editor, and it is my privilege to be your moderator for today's session in the Homeo Vision 2026 webinar series hosted by Homeopathy 360 in collaboration with MNR Homeopathic Medical College and Hospital, Telangana. Homeovision is dedicated to expanding the horizons of homeopathic understanding, and today's topic beautifully reflects that vision by connecting the timeless wisdom of the organon with the advancing frontiers of modern scientific research. We often find organon as philosophy, as doctrine, as foundation, but today we will explore an exciting dimension. How do Hahnemann's principles resonate with emerging fields like omics science? This session on homeopathic organon and philosophy and omics promises to stimulate both the intellect and clinical imagination. It is my honor to introduce our esteemed speaker, Dr. Gayathri Prasad, professor and HOD, Organon and Homeopathic Philosophy Department in MNR Homeopathic Medical College and Hospital, Telangana. Dr. Gayatri is widely respected for his clarity of thought, depth in classical philosophy, and his ability to make Organon not just understandable but clinically alive. Sir, we are truly grateful to have you with us today.
Thank you, madam. Thank you for the wonderful introduction. I am sorry for the delay, but we will start the webinar directly. So I thank Almighty for this opportunity, and I thank Hahnemann sir for this opportunity. And I thank the team of Homeo Vision 360 for giving me this opportunity. Now the topic starts with what is this omics and how to link this with modern insights. I'm starting my presentation. Is it audible, visible?
Yes, we can see that you are audible. And audience, if you have any queries, please put them in the Q&A box and we'll try to take them in the end of the session with our speaker. Thank you. The stage is yours, sir.
Just for a second, just for a second. Sorry, madam. Start the topic.
Not
So
a
coming to
problem,
the
sir.
talk, actually, whenever we say homeopathy always the people they say search Google homeopathy, then you have various definitions for homeopathy. One of the popular definition, unfortunately, says from Wikipedia, which says homeopathy is a pseudo-scientific system. Now, this is something really it hurts for all the homeo doctors. We say that we are scientific doctors, but still Wikipedia recognizes you as a pseudo-scientific system discovered by Hahnemann in the year 1796. Now, going on to explore homeopathy from website point of view, everybody says homeopathy is working at an energetic imprint. But coming to one of the strong criticisms which we all have to accept is we don't have any scientific evidence. Now, this has been said by people since the beginning that Hahnemann was correct on that day, but today he's outdated because we don't see Hahnemann in the modern life scenario, especially the people from higher platforms. It really hurts for our non-teachers and for all the homeopaths that are we not updated? Are we not able to present homeopathy in a proper way? Now, this is how the challenge which we all have to accept and better we address in a proper way. Now, not to waste further time, let us take these words omics, which we have title for the topic omic. What is actually omic speaking for? Omic is a suffix which is generally used in molecular biology. It is trying to map up the structure, functions of the DNA, proteins, metabolites which we see in the cell, organs, and the organisms. This is important for us because the terminology is a suffix, and on that we have many words to add up. So omics is a general word in biology which is meant to say the structure of the function of the cell. In the cell, especially the proteins, metabolites, and the gene. Coming to the number one word which I want to introduce to the audience is genomics. What is actually genomics is? Genomics is a word which we have in molecular biology, which is trying to understand genome. Now, there's a word called genome, and this genome is not a gene actually. When we read biology in our school days and intermediate days, they say gene is the one which is there in the nucleus, and gene is a part of DNA. Gene is not the entire DNA, but gene is having all the material in it. But to completely study the DNA, we have another word called genome, and that is a buzzword for us. That is genome, genomics. Genome is the one which we want to study thoroughly. That is the entire DNA in total. As a doctor, if you ask me, it helps me in understanding for medical diagnosis and treatment because it will help me to treat personalized medicine, which is the key word in homeopathy, and it will help me to understand the genetic predispositions. Genetic predispositions are the word which we use from organon point of view. That is, the diseases are being carried from generations together, and that actually we can study with the help of genomics from medical point of view. That is from scientific point of view. Another word is epigenetics. Epigenetics is another word where we are able to study the heritable changes in the gene through generations together. It is not one individual, it is from generations together without altering the DNA sequence. Mind well, here we can able to study it, and we are influenced that genomics, that epigenetics is being influenced by lifestyle, diet, disease, even medicine. We can able to study this. So another word is epigenetics. Without altering the DNA, we can study this. And as I said you, all our causes, what we say, which is influencing the miasm to behave, that can be understood from the perspective of epigenetics, whether the exciting cause, the so-called environmental cause are really modifying the miasms and asking to behave it in a particular fashion that can be helped through the word epigenetics. That is, a modern scientists understand this word called epigenetics. The third word in this series is proteomics. Proteomics is another omics where we are studying the proteins in a larger scale. Here, as we know, proteins are the workhouse of the cell, and they actually are being guided by genes. Genes are making the proteins to behave. In real time, if you ask me, the proteomics are more dynamic. They are more dynamic in the sense, in the actual situation, proteomics is helping us to understand the actual situation happening there. The presenting phase of the disease, the presenting totality is more understood with the help of proteomics, whereas genomics helps us in understanding static DNA, which is not being altered. Likewise, the order, we have the fourth word, that is metabolic, metabolomic. Metabolomic is another word which is understanding of small molecules which we see at the end phase, which is in the real-time situation. So we have four words being introduced: genomic, epigenetic, metabolomic, proteomic. Among these four, the metabolomic is the last in the order, and it is more dynamic than proteomic. So proteomic is dynamic. Still more dynamic is the last end changes which we see at the patient end, that is metabolomic. As a clinician, if you ask me, metabolomic and proteomic are important. That will help you to understand the real life situations, and epigenetic and genomics are in the background as such. Now, this is all the terminologies which I have introduced. And if I'm not wrong, all of us are familiar with the word nanomedicine, that is medicine in nano level beyond the Avogadro's number. Now, this is all the terminologies from the perspective of omics, genomic, epigenetic, proteomic, and metabolomic. Now, these concepts, whatever we have learned, these words we have learned, we need to apply this from the perspective of homeopathy. That is, we as a organon teacher, as a homeopathic student, always we hear these words: individualization. Individualization is the key buzzword in homeopathy, where we say we have to treat patient individually. Susceptibility. Susceptibility is a word which we say that how the patient or person has reacted to stimuli. This can be in perspective of both health. This can be in perspective of both disease also, because as we say in disease, patient is susceptible to any stimuli. Likewise, medicine also is susceptible for and is reacting to medicine more adequately. Another word is theory of chronic miasms, which we'll be discussing eventually, and potentization. These words we need to integrate from omic point of view. Now let us start the concept of organon, what organon actually Hahnemann mean to say, and how to apply this organon from current scenario. Number one, that is aphorism number one, which says that is the organon is a working tool for us. We always say it's a working tool. Let us explore this tool in a proper way. Aphorism one says, cure is the mission. The only mission for a homeopathy doctor is cure. That is what we stay from our first year BHM onwards, saying that our mission is to cure. To define the cure, Hahnemann has clearly explained this. It should be rapid, gentle, and restoration of health, along with removal of symptoms in the entire toto. Now, this he has explained. These are all things we need to apply from the modern insights. Now, aphorism 3, this is important for me because in aphorism 3, we says how to apply this, how to get the cure. We always say knowledge of disease is important. Thereby, we say the knowledge of disease in individual, knowledge of medicine in individual, application of medicine knowledge to disease knowledge. Now, this is how we were being discussed in our UG and PG also. Let us be more elaborate on this. Whenever we have a knowledge of disease through symptoms are not the only guiding tool for us. We have to go ahead of symptoms. We need to understand what is the pathology running behind the symptoms. This is more important to me. What is the pathology behind the symptoms? Because always we say that our homeopathy disease patients, when they come to us, they will tell the symptoms. But as a clinician, you need to visualize what is behind the symptom. Thereby, this omics is again helping us to understand this patient in a better way because it will help to understand what is the protein changes, what are the metabolite changes happening at the end level. This we will try to have a conclusion at the end. Likewise, if whenever we read a remedy from Metromedica, our only source is symptomatology because symptoms are the only one which a prover will narrate after taking the medicine. But this medicine, as well as I said, whenever the patient is narrating the symptoms, now you need to open up and you need to understand what is the pathology running behind these symptoms. So don't be near with the symptomatology talk of the patient or a prover. Try to be ventilate or try to be very clear with the what is in the background of the patient or the prover with the pathology. Now the third is choice of remedy and application of disease knowledge to drug knowledge. That can be done with the help of this omics. Let us have this view again. The same thing what we understand in knowledge, it coming to application part in practical, Hahnemann says in aphorism 371, that is 3 points necessary for cure. That is, you need to apply this knowledge. Knowledge of disease, knowledge of instrument, knowledge of application of this instrument. So aphorism 3 is knowledge, application part is purely practical, that is third of 71th aphorism. Now, another important aphorism, very important to me, is aphorism number 5. And whenever we read organon classification, especially dynamic diseases, we have two, acute disease and chronic disease. Aphorism 5 says you have to be very clear with the exciting cause of acute disease. But as an organon teacher, if you ask me to elaborate, I am more interested with the exciting cause and as well as the effect of the exciting cause. Because not only the cause is important to me, I need to know what is the effect of the exciting cause because that is making the medicine more personalized. Because as a simple example, if you ask me, exposure to cold air, patients will have group of symptoms. One may have headache, one may have chest pain, one may have gastric symptom, other patient can have amenorrhea. Now, for all these patients, you can't use single remedy. You have to think of personalized medicine for individuals. So not only the exposure to cold air, but the headache, chest complaints, gastric complaints, as well as for amenorrhea, I need to think of a group of separate remedies, not the same remedy. This is for the acute disease is concerned. Now coming to the chronic disease, as we say, they are because of chronic miasm, that is our fundamental cause. And in aphorism 5, Hahnemann explains how to get the fundamental cause, that is through the 7 points, but we will take this more from practical approach through our discussion. Another important aphorism for me is aphorism 9. We have to be very modern in our approach of saying what is vital force. You can't say that it is something invisible. A modern researcher cannot accept such dynamic words which are interesting to a homeopathy student or a teacher, but in real time we have to be more scientific. As we read aphorism 9 saying that vital force is the one, but in modern scenario, if you ask me, that is genome. And already I have told you what is genome. Genome is our whole strand of DNA containing all the genes. That is the word, modern word for our explanation of vital force. Now let us see how vital force is really genome. There are articles on this, but let us be more practical with aphorism number 9. Aphorism 9 says, vital force is the one which is regulating all the vital operations. But modern science will say, genome is the one, it is the one which is regulating all the vital operations. It is only the genome, the DNA will decide what vital operations to be done, both in state of health and disease. And definitely, the vital force is nothing but genome in the modern day scenario. So, our terminology is to explain vital force to a genetist, a modern clinician. You can use the word genome, don't use the word vital force. He may not understand vital force, but definitely he can understand the word genome. In continuation of this talk of genome, we say vital force is there, that is genome, in both conditions of health and disease. And both these conditions of health and disease come with the word life. Now let us understand this definition. What is life? Always we say life is one which is existing in constant interaction with living and external environment. What is with inside is living and what is outside is external environment. It is always being controlled through this inside genetics and outside external environment. That is the very property of life. And as I promised, like genetic code is the one which is inside and how it is reacting is outside. Now this life is having two conditions. One is state of health and second is state of disease. In state of health, as our Organon definition says, all the expressions of vital force are in perfect functioning, so that all the body parts are perfectly functioning and there is a general sense of well-being both physically and mentally. So that is where we ask patients saying, how are you? This is not a patient now. He is a healthy person now. This healthy person will say, I am healthy now. I'm enjoying my health. There is no complaint. There is no symptom. I'm having a good appetite. I'm having a good proper sleep. My mind is clear. My thinking is clear. I'm able to understand the things very practically, rationally. There's no complaint as such. This is the where our genome is in the state of health. And any invader which is trying to pervade the body inside, our genome, that is our vital force, is trying to push this outside. Various cell defense mechanisms are there, like skin is expelling the invader through sweat glands and sebaceous glands. Intact epithelium skin is protecting from the invasion. GIT is doing this through salivary, gastric, and peristalsis. Respiratory tract is not allowing the invader outside through epithelium, cough reflex, eye through lacrimation, kidney through urine flushing, or body cells through complement and phagocytic self-defense mechanism. Now, this is how the cell is protecting itself. But that is not the case in case of disease. There, the self-defense mechanism got a hitch. There's a problem, there's a block. Here, the awareness of disease is known through sensorial symptom that I'm not doing well. What was health during health, it's not now the same. I'm sensing something is really wrong. That is what the first symptom a patient will tell. Continuationally, if you see the functions are getting altered, then the last is organic symptom or structural symptom. Now, this is the order in which the disease will behave to a clinician. We have to sense that first senses are getting disturbed, then functions, then organism. But as I said, all are being regulated by genome. That is what for us as vital force. In acute disease, it is like a transient explosion of latent sora that complaints will come and go. Most of the times, the acute disease will have few functional symptoms, at the most slight structural symptoms. This is very important to understand that acute disease will not have much structural changes. It's very, very minimal structural changes. Functional symptoms are more. That is where patient come to your OP and you give all wonderful acute remedies, armamentarium. They are really helping you. Here, our self-defense mechanism is having a good amount of role with the medicine, and our vital force can really allow the infection to control, and our medicines are doing wonderful there. Now, that is not that easy in case of chronic. In chronic diseases or because of chronic miasms, when you read this from the perspective of genetics, they are the self-defense mechanisms. They are the self-defense mechanisms, but they are being controlled genetically. Or chronic disease mechanisms are genetically controlled. So vital force, genome, genetic, epigenome, they have a good amount of role. Here, the miasms, as we say, are the cause. The epigenome is the cause. But equally important is the end changes which we see through effects. So for me, if I am not wrong, miasm is both cause as well as effect, because there is a cause as miasm, like psoric cause. Psoric effect is very specific and is genetically determined. Likewise, psychosis cause, psychosis effect. It is also very specific and it is genetically predetermined. Likewise for tubercular and likewise for syphilitic miasm. All are genetically determined self-defense mechanisms having a specific cause and specific effect. Whenever we ask the patient, what is the cause, where we inquire, what is your past history, family history, we are trying to inquire, what is your self-defense mechanism pattern as such. Because patient, when they tell, this is my past history, this is how I was reacting to my external environment or genetical pattern, that is how we are trying to understand what is his cause, how his self-defense mechanism was working. Let us take one by one. Sora is the first self-defense mechanism. In the order, if you see, number 2 comes psychosis, number 3 is tubercular, number 4 syphilis, conventionally speaking. So Sora is the first defense mechanism, next psychosis, third tubercular, and fourth is syphilitic. In the order of cure, syphilis should go back to tubercular, then to psychosis, in the last should be Sora. Sometimes if you see, Sora can go to tubercular, then again back tubercular to Sora. Sora can directly go to syphilitic, again syphilitic back to Sora. This order is important me in the treatment. That is, Herring's law of cure goes with this notion only. Sora to psychosis, tubercular, that is more important organ to less important organ is in this way you have to understand. That is more important to less important, center to peripheral. Now let us take one by one the defense mechanism. Soric defense mechanism is number 1. That is the primary level we are trying to protect. Still the invader want to go. It will show either irritation or inflammation, which is purely functional. Then the last is structural changes. Let us see the first defense mechanism, that is Soric defense mechanism. This, as I said, the functional changes are being more manifested. The functional changes. As a sensitizing miasm is Sora. First time there was a sensitization to this, and here you see the invasions can be both emotional or physical. Not every time the cause is physical. Sometimes it could be emotional. Patient got an exposure to grief. Patient got an exposure to anxiety. Patient got an exposure to shock. The body is trying to have some self-defense mechanism, self-defense mechanism. The same likewise goes for physical exposure to heat, exposure to cold, exposure to some food. How the body starts reacting. The system starts gearing itself through quick, immediate mobilization of natural defenses. So it's very quick and immediate. Now, how the patient will tell? He will have sudden onset of symptom. Why? The defense mechanism was very quick there. Sudden onset of symptom, but very important, intense changeability with fast recovery. Intensity is more, that is, violence is more, changeability will be very fast, but good recovery. And here, more or less, it will be either irritation or inflammation without much suppuration. This is an important word, without much suppuration, and the residue you can easily have undergone, like residue can be easily cleared through skin, through mucous membrane. So patient will have some problem, either it will be a skin eruption or through some mucus discharge, the complaint has been terminated. There is no much suppurations. By physiologically speaking, the body defense mechanism, that is the reticuloendothelial system and the neuroendocrines, they get activated and they will start functioning with minimal structural alterations. Here, the patient will have generally sensations as a complaint and irritability, that is pain as a complaint. Sometimes he will have breathing complaint. Sometimes he can have some evacuation complaint, that is bladder issue, bowel issue. Sometimes he will have some emotional complaint like anxiety, fear as a complaint. But all these are temporary. They are not for long time. They are usually temporary. This is the first defense mechanism, that is SORA. And as I told you, this is being genetically programmed through genome. Number two is psychotic defense mechanism, that is formative miasm. This is also innate. This is innate. And here we see the second defense mechanism as constructive defense mechanism. There you see acute in SORA. Here we see chronic inflammation with slow recovery and scar formations. Now here the defense mechanism took a shift of gear, where you see the structural changes are happening, excessive production and accumulation of tissues, whereas the constructive defense response, that is growth formation, overgrowths, thickening, fibrosis. This is one of the way the psychotic pathology runs. Number two, desentoration or loss of control over immune response with inefficient and inappropriate aberrant with not recognizing self, thereby it is having a slow, gradual inflammation. So always psychosis has gradual inflammation, but low resistance to infections. That is why it's a gradual recovery. Medicines also have to go with the gradual recovery. Number three, that is psychoneuroendocrino and reticuloendothelial system are getting slowed down with tardy metabolic process, where you see a lot of depositions inside, that is water, sodium, sugars, and lipids and uric acid. Now here the complaints are usually with hypertension, diabetes, angiopathy, varicosity, strictures, glandular indurations, obesity, allergic inflammations, calculi. All these are retentions, slow defense mechanisms. Here there is a gradual, that is chronic inflammation with slow recovery. This is the second defense mechanism. Number three is tubercular, if you remember. Tubercular is heightened SORA. It is SORA plus syphilis, as we say. SORA, heightened SORA, with increased activity in course of time, leading to debility. That is why we say tubercular patients are usually weak, because it is increased activity over a period of time, leading to debility. Number two, having aberrant allergic spasmodic erectile recurrences. It is allergic phenomena more of. So allergic phenomena which comes and goes, spasmodic, erratic. The behavior is erratic with a recurrent. So it's like overstimulation of RES and PNS, overstimulation of sympathetic nervous system with severe debility profuse perspiration, and ravenous appetite with emaciation, chronic inflammation with suppuration, which was not there in Sora, delayed healing with fibrosis, tardy convulsions, protracted recovery with periodicity. The patient will have slow recovery, will have a lot of convulsions issues where you have to go for another antimiasmatic medicines if you don't treat with miasm. The last is syphilitic. Syphilitic is again another innate, which is with destructive defense mechanism, overstimulated and exhausted system with continuous inputs leading to loss of control and inadequate functioning. Suppuration is more here, which we don't see in Sora. Healing is never clear with a lot of scarring, deformities, disfigurement, and crippling. Easy destructions, severe pains, ulcers, cracks, and infarction, all the terminal autoimmune diseases with CRF, that is chronic renal failure, acute renal failure. Try to remember, we are not discussing symptoms, we are discussing the pathology behind the symptom in the reason of this pathology. As I said, they are all genetically programmed. So when our patient come to our OP in inquiring the miasm, I'm trying to read what is the pathology behind and what kind of self-defense mechanism it is running with. Now, another important aphorism, which I give the due credit to Dr. Biju sir from Kerala, he has told in one of the seminars saying that we have homeopathy medicines for these genetical complaints. When I read aphorism 284 footnote, Hahnemann says mode of administration of medicine for genetic complaints, that is for psoric ailments, give a dose of sulfur or any suitable antipsoric to the mother, pregnant mother, so that the baby unborn will be free of these miasms. In modern scenario, we can do really such things. So here Biju sir has said like all nosodes, especially nosodes, syphilinum, tenem, carcinosin, tuberculum, medorinum, sulfur, sorinum, they all are nosodes and prominent anti-miasmatic medicines. They can really minimize the genetic complaints to the next generation. Biocombination number 26, which is for good easy delivery, that can be given for the last week, that is 28 week onwards, and Pulsatilla and Calophyllum Q can be given depending upon the condition. But this first 5 medicines, which is syphilinum, carcinosin, tuberculum, medorinum, sulfur, and sorinum, this can be really doing a lot of genetical complaints if we can do on time. Now, how to apply this omics? That is our key discussion for today. Can we really apply omics to homeopathy, to organon? Yes, we can really do, because what we have told in our college at a scientific level, these are being discussed with new names. Individual susceptibility. What we say that person is susceptible to miasm, to which kind of miasm and what are the symptoms. At the end level, that is nothing but our proteomic or metabolic changes. If you can read this proteomic or metabolic, that is nothing but the individual susceptibility that a modern scientist can do. Miasm. Miasms, they act on genome. As I said, like epigenome, epigenetic is the one which is being like the hereditary DNA we are able to study without altering the pattern. Thereby the susceptibility to die through environment, through medicine. Likewise, through disease. Miasms are nothing but epigenetics only. Explaining totality of symptoms to a modern doctor, nothing but we are explaining to him the genomic, proteomic, or metabolic. If he understands genomic, proteomic, metabolic, that is what actually totality of symptom mean to say. And miasms are nothing but our epigenomic or metabolic profiling. So omics, as I said, omics, that is for all in short, omics is helping us to understand a dynamic derangement. Totality, what we say is a dynamic derangement. Vital force is being deranged by vital force is being deranged by miasms. Omics is nothing helping us to understand the situation in real time. Some similar words which is important to understand is vital force is nothing but our genome and epigenome axis. Whether the vital force is in health or in disease is nothing but the correlation to genome and epigenome. Miasm is our epigenomic imprint and dysregulation. Proving is important. Whenever we prove, we are trying to understand the changes in the prover. Not only the symptom, in perspective of omics, if you ask me, we are trying to understand different provers of different ages and both female and male gender, if you ask, they are different phenotypic presentations. They don't have the same genetic complaint, but they have different phenotypic. If you can record all these drug proving symptoms through omic level, you can understand what a drug can really do at a omic level. That data, if you have for each individual drug, if you understand that data thoroughly, that application, if you can do on a diseased person, that is nothing but application of similar to disease to drug. This is very, very important whenever in future drug proving trials have been done. They don't have to limit, not to limit only to the symptom or to the pathology. Better they have the omic study also. It will help us to understand homeopathy in a better way. Case individualization. Case individualization is, as we say, personalized medicine, because not all the individuals have same genome. Not all have the same proteomic or metabolic changes. That is varying from person to person. If as a clinician, I know what are the omic changes at each individual level, that help me to understand this patient in a better way and give him the personalized medicine for complete cure in the long run. Minimum dose is important because when we understand omic therapy, we don't have to go for large crude doses. We can go with a minimum dose at minimum time. We can bring all the wonderful changes. Direction of cure, if you see, we can set back all the disturbed networks. These studies have been done before. It's not me to discover all these things, but we have to compile it. We have to properly present it to the modern study, modern homeopaths, because unless we don't do, that loss is much. Vital force, as we say, is nothing but our genome. It has been given a presentation in 2020. There's an article saying that how vital force is being linked to genome. Drosera, another study where says Drosera is bringing changes at genetic level. Till now, we have understood Drosera at whooping cough, TB, but never it has been understood that Drosera is really bringing changes at genetic level. Yes, it will really do, because there was a study done saying that Drosera 3x, it was given for airway complaints and it had brought changes because there was already a change in the human bronchial epithelial cells. That changes were auto-repaired, it is self-repaired through the help of Drosera 3x. Another study that was done on Apis. Apis, it was given in mother tincture, 3C, 5C, 7C. It too brought the genetic aberrations to normal. That is, it has helped not only at the symptom level, it has even helped at the genetic level. It has been studied. So these are papers which have to say saying that homeopathy medicine not only acts symptomatically, clinically, or through some pathological evidence of blood or urine samples. There are some studies saying that homeopathic medicines act at a genetic level. This kind of education we have to give to our graduates and postgraduates so that they can understand homeopathy and they have to practice homeopathy. Have to work on homeopathy in a better way. Another study saying that HeLa cells, which we see in cancer of cervix, where Khuda Baksha sir, a veteran in homeopathy researcher, he has said that Hydrastis, Can, and Condorango had done some apoptosis changes which placebo does not do. So this means to say that cell-programmed death, that is apoptosis, can be done through homeopathic medicines, which means to say genetic changes are happening really in homeopathy. Another study says that carcinoma, so where glucose 30 arsenic arnica was given for the complaints, and there they have seen that our medicines are bringing changes, that is, they are giving some signals. Because of that signals, the genes are getting on and off. Mean to say, we can decide how the cell can behave based upon our medication. So these are all the study which has done. So my suggestion to the future generation that we can do a lot. We need to integrate with these scientists. We have to study. By doing so, homeopathy is not called as a pseudoscience, it's called more than science because omics helps us to understand the pre-changes and the post-changes. If you can know the patient data before the treatment, and if you give the correct remedy, you can see the genes functioning at a metabolic level and a proteomic level before the treatment and after the treatment. You are very sure that your medicines are acting in the correct direction. Number two, remedy correlation in its metabolic pathway in both conditions of disease as well as at drug proving level. It has to be done. If you can do, you can understand that when the drug is acting, how it is acting, to what extent it can act. If not, then what next can be done. Exploration of biomarkers is important, especially after the post-remedy administration. This is helping us to understand the patient in a better way. Genes, which can be up and down regulation after remedy administration, especially the anti-miasmatics will bring down all this, and equilibration of metabolic stress pathway. Because when we read homeopathy, already the patient had some stress mechanisms because of which the gene and the cell had some altered behavior. By giving homeopathic drug in minimum dose, again you are bringing back this metabolic error to normalcy, that is to disequilibrium to equilibrium. This can be proved at a cell level in vitro stages. Not only that, omics is helping us to understand the symptoms recording after the administration, whether it is going as per the Herring's direction or it is going away from the Herring's direction. So we are very much sure what quantity of medicine can be given and whether it is really bringing some changes. Not only the clinical way, omics is also helping me to understand and making homeopathy more scientific. Very important for all of us is homeopathy is evidence-based. Observation of changes is important, and our anti-miasmatic medicines can really do this. So these are my insights on the topic of omic and integration to organon. So any questions I'm ready to open. Make sure that homeopathy is understood as a science, not as a pseudoscience. And organon, the working tool, is having some guidelines on this, but we need to integrate with other future researchers because they are helping us to understand our organon in a practical way. Thank you. Thank you for all the patient listening. I'm ready for the question and answer session.
Dr. Prasad, we are truly grateful to have you with us today. That was incredibly enlightening session. You have beautifully shown us how classical philosophy is not separate from modern science, but rather a foundation, and that can be viewed from newer lens. I will now move on to the interactive segment of today's webinar. We are joined by a student representative from the same institution who will bring in the learner's perspective and share questions that commonly arise among students so that Dr. Prasad can share his expert perspective. We have Dr. Raghav Datta. He's an MD scholar in the Department of Organon. Dr. Datta, please take us through. I think Dr. Datta will join shortly. He's having some technical issue. By that time, audience, if you have any queries, we'll try to take them up. Right. So we have one question by Dr. Salva. She's asking why anti-miasmatic remedies are not enough to cure.
Again, madam, once again, why anti-miasmatic medicines are
not enough to cure? That's a question.
Anti-miasmatic medicines are not enough to cure. Okay. It's not merely the truth, madam, because medicines are anti-miasmatic in a sense. That time when you read Hahnemann saying sulfur is the remedy for sora, there again he has listed out saying that various other antizoric medicines are required. king of Sora is not sulfur alone. There are very other antizoric medicines have been required. Sulfur along with carbovage and sepia was given for skin eruptions. So this is the point which we have to be very clear. Various other medicines we have to select at very given point. So understanding miasm, you understand that it is not single remedy for all the miasms. We have to explore various other medicines. In this order, if you go, nosodes are having a good amount of role. Nosodes are more deeper than our antisorics or psychotic or syphilitic. Thereby, because they are more deeply imprinted in our gene, miasms. Epigenes are being deeply imprinted. The miasms are being deeply imprinted. They are being carried from generations on. It is not single generation. When we ask the past history or family history, we generally ask, how is your father? How is your mother? Let us be more clear. We should have actually asked, how is your father and how is your mother during conception? During conception says, what was their health status? Because that is how the genes are being carried at the time of conception. We generally ask, my father is having BP, my father is having hypertension. That is not sufficient. You should have asked before to the conception, how was their state of health? That is how we have to retrospectively ask in the generations past. Thereby, you will understand how the father was during conception. And here, as I said, nosodes have a good amount of role. So nosodes can take really the upper hand over antizorics. And it has to be given not less than 1 m or 10 m. If I give sulfur 30 and say my miasm is getting cleared, it is highly impossible. I have to give sulfur in 10 m, 50 m, cm. The same applies even to nosodes also. So possibly, if I'm not wrong, we didn't explore miasm to various antizoric medicines at a higher potency level. We have limited only to 30, at the maximum 200 or 1 m. That is why they don't work wonderfully. You would have really tried for 1 m, 10 m, 50 m, then the results would have been much better.
Right. One question we have received is that in some modern drug provings, researchers are now collecting genetic data before and after the proving starts. How do you
Yes.
think this genetic proving will change the way we understand our remedies, materia medica in future?
Yeah, because genetic presentations help us to understand this remedy, how it will behave in different situations.
Okay.
This is this is really helping us. In future, actually, are we sure that our drug will definitely cure? Because tomorrow the student will ask us, are we really sure that the drug will really cure? Number one, not only at the symptomatic level, but at a genetic level. Definitely, this data will help me to understand, Babu, this is the study, it has been done. You can verify this not only at the symptomatic level, at the clinical level, the genetic level also it is helping us to understand the subject better. It will give him confidence to practice homeopathy.
Right. Another question is that vital force can be viewed as genomic epigenomic axis. So, does
Yes.
this imply that the vital force is purely a biological manifestation of our DNA? Is the genome simply an instrument through which a higher material force operates, or is it
Yeah,
something?
this is philosophical thoughts actually. When we read as such, we say vital force is something immaterial, and the medicine is immaterial. The disease is also immaterial. To a homeopathic student, it sounds interesting and amusing, but to a scientist, it has to be explained in a scientific terminology. So
Absolutely.
definitely, genome is the correct word to understand for vital force. It can be appreciated better. Instead of saying that vital force is immaterial or invisible, if I say vital force is genome, it is understood better for a science student.
Right. For aphorism 284 that you referred in context of genetic simillimum, does this suggest a future where the totality of symptoms is replaced by totality of omics data?
Yes, that is what we have to see because proteomic and metabolic are the real life situations. they are actually the presenting totality to us. When patient they come to you, they have some changes. That acute changes, what we say, they are the metabolic or the proteomic change. Behind to that actually is the genomic change. So totality, in short, if you consider both presenting and past, the genomic, proteomic, and metabolic together, it has to be integrated, and the medicine has to be selected based upon that. Acutely, we give for proteomic and metabolic, and in the long run, it has to be given with genomic changes together.
Right.
That is, it has to be integrated in the long run.
Right. One last question. For students who want to learn more about omics and homeopathy, where should we start? Is there any simple book or a website that you can recommend?
So, madam, this today the scenario is everything is openly discussed. We have to search Google, Chat GPT, etc. There are some books on nanomedicine which was given by Rajendran sir, where he says that where the changes are being seen at a micro level, at a nano level. So there are good material. For the cell defense mechanisms, as they are not teacher, if you ask me, we have to link homeopathy from cell physiological perspective, because even Guyton says, even our pathology book says how the cell will behave. We need to think it only from the beyond of academic. We have to think from the perspective of clinical point of view. Enough material is there in websites and enough material is there in books, but we need to compile it. We need to sit with the researchers. Then we can have a proper answers for all this.
Absolutely. Thank you, Dr. Prasad, for those clear and insightful explanations. I'm sure our participants found these clarifications extremely valuable.
Thank
As
you,
we
madam. Thank you.
As we come to the close of this session, I would like to sincerely thank Dr. Gayathri Prasad for such a profound and integrative presentation, Dr. Raghav Datta for giving us the questions, MNR Homeopathic Medical College and Hospital, Telangana for their academic collaboration, and of course, Homeopathy 360 for organizing this wonderful knowledge sharing platform. Today's session reminded us that homeopathy is not just rooted in history, it is continuously evolving in dialogue with modern scientific thought. Sir, would you like to say anything as we close this webinar?
I thank all of you for patient listening, madam, and I thank the team for giving me this opportunity to talk. Thank you, madam. Thank you.
Thank you all participants for their active presence and engagement. We look forward to seeing you in the next session on Homeovision. Have a wonderful night ahead. Thank you everyone. Goodbye.